Welcome back to Rural Health Today and our latest series, Rural Health Fractured. In this series, we're discussing how rural health is being fractured in nearly every direction by the politicization of health and science, the decline of resources for rural communities, deterioration of adequate insurance coverage, and so much more. As we take a closer look at the fault lines in our healthcare system, our guests will provide new perspectives on healthcare leaders and how they can navigate these challenges and explore sustainable solutions. So today I am thrilled to be in the studio with today's special guest, someone new to the podcast, someone new to the series. It's great to have you here today, Heidi Hagel-Braid from First Children's Finance, Chief Executive Officer, and that I have no clue what your organization does, but I am so excited to learn about some of the great work that you're doing because my team did brief me on the work and it is pretty incredible. But for our listeners today, they may not know, obviously, the work that's being done, who you are. So why don't you tell us a little bit, Heidi, about your role at First Children's Finance? How long have you been there? What brought you to that organization? And why in the world did you choose this field?
Well, thank you for that wonderful greeting. I'm so happy to be with you today, JJ. I'm Heidi. I'm the CEO at First Children's Finance, and we are a national nonprofit that focuses on the business side of childcare. Our mission is to build the sustainability and supply of great childcare. And I think why I might be here with you today is that in the last decade, we've been working in earnest to build childcare supply in rural communities. So we're a national nonprofit. We have footprints all across the country. We work with communities all over the place, and specifically rural communities.
Well, that's a lot, and that's a high-level overview, but I look forward to jumping into the weeds here in just a minute to learn about some of the great work that you're doing that impacts the rest of this country. It's not just isolated to a specific region, so I'm very excited about that. But, you know, Heidi, for someone who just heard that amazing job title and what you do, let's humanize you a little bit. And we like to do this on each of our podcasts, is that we ask our guests to share a little bit something about themselves that might be an interesting fact, something neat, something that the listeners can help identify that, you know what, Heidi is a real person.
I'm real, I promise. Well, I'm joining you from my office in Minnesota today. I'm originally from North Dakota. I grew up on a farm in a very tiny community. I'm not sure if you have many North Dakota listeners or guests, but
We do.
maybe
We
I'll
have
get
quite
to
a
be
few
your
guests
first.
from North.
Oh,
Yeah.
great. Fantastic.
So how big was the community though? See if you got me beat.
Well, I grew up on a farm,
Okay.
so the closest community to me, I think, had 20 houses,
Oh, okay.
Doya, North
You
Dakota.
got me beat. You got me beat. Ours had like 30.
I out-ruraled you today.
Exactly. Exactly. You're more rural than I am.
That's right. That's right. So I live and work in Minneapolis. I am a mom and stepmom to 3 kids, and when I'm not busy working and working in the childcare sector, I am trying to keep up with complicated landscape and chasing kids.
And probably that is some of the most rewarding things, though, is, you know, chasing after kids, doing some landscaping after a very tough, rigorous day, especially with what's happening around this country with healthcare and some of
Yeah.
the challenges you're facing with access to care for children, reimbursement, and we're going to dive into some of that, Heidi, in just a minute. But it's great to have you on the podcast. One question, since you are more rural than I certainly am, how many friends did you ever take cow tipping?
Well, I have never gone
Okay.
cow tipping.
How many times have a friend taken you cow tipping? Okay, all right. Well,
I don't think I've been
okay,
cow
all
tipping.
right. For our guests who know what cow tipping is, it's for those city slickers who will have to Google that. All right, Heidi.
That's right.
Well, let's just jump into some meat and potatoes here, and a little bit about what's going on in our country right now as it pertains to as you look at First Children's Finance and the work that you're doing, but childcare, issues that are impacting adolescents, all of those things. I really want to dive into that here in just a minute. And for our guests that are just tuning in, we're talking about childcare access in rural communities specifically today. Heidi is here to share her perspective and the work that she's doing in bringing childcare to rural areas that overlap between childcare and healthcare, and there's a critical infrastructure that's happening there. And we'll talk about rural barriers to childcare because there's lots, and solutions that can exist in communities to strengthen those childcare programs, and of course, what all this has to do with rural health. So first, Heidi, tell us a little bit about First Children's Finance. What is it? How did it start? Nonprofit, mission-based? Give us kind of a perspective from your viewpoint of the work that's being done.
Yeah. Well, we've been around since 1991 and been working specifically on the business side of childcare.
Okay.
So when you think about childcare, you think about kids and families first. And shortly after that, though, you have to think about the supply of childcare. It's so incredible. And you might be wondering why in a healthcare podcast we're talking about childcare, but it really is a marker of a healthy, vibrant rural community. So the access to childcare is incredibly important. And why we work on childcare is because it's a really challenging business model. You might think, hey, there's lots of people in my community who have kids. They must be making money hand over fist in that childcare program down the road. Yeah. The truth is that it is labor-intensive work. It's critical work. It's expensive to provide. And actually, it operates as a market failure. It can't charge the amount of money that it is required to actually break even. And yet, our communities rely on a steady supply of childcare. And so that's why we do this work. These businesses are owned and operated primarily by women. And they exist everywhere in your community, whether you're urban, rural, or something in between. And they're so incredibly important to communities, and they have almost no recognition of that. So we've been working on the business side of childcare for almost now 35 years. Wow. And we're working to make sure that those businesses can operate sustainably so that they are able to survive and that communities can rely on them. Because as we talk today, I think you're going to understand how important childcare is as a piece of infrastructure in rural communities.
Yeah, and I'm excited to dive into that here in just a minute. And I guess let's talk about setting the stage, okay? One of the things that we know right now, that I know, is access to childcare is difficult. But I only look at it from the lens of my community. So what I would ask that you do is paint for us the picture of what childcare access looks like at a national level. Let's start there. Mm-hmm. Let's start really high level, and then we're going to get into the weeds here in just a minute.
Yeah. So one of the things that I think we want to share with your listeners today is that what we experience in our country is really classified as childcare deserts. That is a definition that means that to be considered a childcare desert, that there are children, approximately three children, for every one licensed childcare slot. Wow. And there's some new research out recently that talks about the rurality of childcare deserts, that the deserts in rural communities are even more stark than that. And what that means is that for moms and dads or families who are helping to transport children, when you want to live and work in a rural community, you need three things. You need a place to live, you need a job, and you need childcare. And what we're finding over the past decade or longer that we've been working on rural childcare supply is that the triangulation of those three things means that families are potentially on the road multiple times for a long distance trying to get to childcare, if they're able to find childcare that can take all of the different ages of their children. So if you've got an infant and a preschooler, you might not be able to find childcare in the same location. So mom and dad, or maybe grandparents or helpers in that family, are transporting children on the road twice a day. And it's incredibly expensive, but you can't find it.
Yeah.
So what we know is that families are settling for childcare options that aren't their preference, meaning that they're just piecing together solutions. We know that parents are opting out of the workforce, or they're remaining underemployed, or they are tag teaming. Maybe mom is a nurse and working night shift, dad's a firefighter on a day shift, and they're just piecing together solutions. We also know that families, if they can't accept a job because they don't have a place to live and they can't find childcare, they're choosing to leave rural communities.
Yeah.
And that is the most concerning thing to me. I grew up in a rural community, I grew up in a rural state, and it's a wonderful place to live and to grow up and to raise a family. And the quality of life that we talk about in rural communities is one of the selling points. And when people can't live there and raise their family, it's a serious issue.
Heidi, let's talk a little bit though about, and I think you may have alluded to it, but urban versus rural. The research and work that you've done, I think I know the answer, but I could be wrong. The stark difference between access in both of those locations. So can you talk a little bit about that? Like, it appears to me that our rural areas have been hit harder with this problem, but I need you as the expert nationally to tell me what the actual data says. So could you help us understand the difference?
Yeah. I think the biggest difference really is disbursement, right? So when we talk about where people live and work, in an urban community, there are still not enough childcare in urban communities either, by the way. But the distance to where you have to travel to find it is much more manageable.
That's a good point.
And there may be public transit that'll help you get there, right? So when we take that same context and we apply it to a rural community, we know that the distances between high quality childcare slots is even greater, that families just can't get to them, that if you look at a county level and where childcare exists, it might be in a population center inside of that county, it might be in a town, but rural communities actually are relying on family childcare, home-based childcare as one of the primary mechanisms for rural childcare. It's incredibly important. So as we think about the ability of people to own homes, that impacts the availability of home-based family childcare. It also means that we have an aging population of folks who have been doing this work for decades, who are getting ready to retire. And there's no one coming in on the pipeline to be able to start these small businesses and operate them. So even if you're looking at childcare centers, which there are some of them in rural communities, they have a tricky business model that makes them unsustainable. They need to have a certain size of enrollment to be financially sustainable. And rural communities really struggle to be able to have a childcare center that can enroll 100 children or more to make that business sustainable. So family childcare is that solution. And for the entire decades of childcare that we've been operating in this community, those are the two primary mechanisms. Really small childcare in someone's home, predicated on the fact that someone lives in that home and can operate that business, or a childcare center, which requires a significantly larger enrollment to make it sustainable. Now, all of that is to say, I don't want anyone to say, stepping away from this podcast right now because we can't do either of those things. What I'm hoping to share with you are some innovative solutions that are rural in nature that are working.
Yeah. Let me ask you a follow-up question, because right now, and it happened in my family, we have what's called generational housing. And you have grandparents raising grandchildren, and you have some of those occurrences. So But that's not daycare. That's not childcare. That is, my 87-year-old mother who, is limited in her scope and in motion. And so that's not our answer, right? That is one of the options, but it's really not a sustainable model. Could you talk and could you talk a little bit about that?
Yeah. There's nothing wrong with
Nothing at all. We
grandparents
did it.
being
We did
involved.
it.
Yeah.
We did it. We did it for years and years and years. But there are limitations.
Yes, there's limitations, right? And so as folks are aging, that is one of the things that, they have decreasing ability to be able to provide that. Or one of the things that I want to focus on is what high quality childcare looks like.
Yes.
And often we think, oh, anybody can watch kids.
Right.
And that is the deep respect that we need to cultivate for childcare in our communities. That actually these folks are entrepreneurs and educators. We have known a lot in the last 20 to 30 years about brain development of children, what they need in early learning environments, and people who do this work are incredibly intelligent, dedicated, fantastic individuals who are nurturing early brain development and healthy cognitive development. And grandparents are fabulous and wonderful, but if this is not the career that they came from,
Right.
they may not know how to do some of that work. And so if we're talking about where children are for their awake hours, their first 5 years, we want them to be surrounded by nurturing environments, people who understand early childhood development and can optimize those early years of brain development when all those synapses are happening. And grandparents can be part of that.
Right.
But if that's not their field of study, we don't want maybe to stress them out with having to take on a whole nother career in their retirement.
It's a great perspective. I mean, they serve a role, but in that developmental stage, it's important that whoever is doing that is committed, understanding that it is of nature a job and a responsibility, not just a service. So I think that's a great perspective when we look at generational housing. It's not the answer to childcare deficiencies in our communities. It's an answer to a lot of things, and certainly the traditions that my mother passed down to my children and the long storytelling and those things are great, builds character and some of those things, but it doesn't meet the same objectives as our childcare would. So I'm going to tell you, one of the things I often hear in our communities is, I can't afford childcare. And I have to either quit working or we have to find other solutions, and that's maybe a sports program that the kid stays over until 7 or 8 o'clock at night. Talk to me about some of those challenges and barriers, because cost is a factor when we talk about rural America, where it's relatively poorer communities, individuals at minimum or just slightly above minimum wage, is the affordability aspect of healthcare. Can you address some of that, what you're seeing, and are there viable solutions at a federal or state level to help supplement childcare? Do you think there could be some advocacy there?
Yeah, there's so much happening, and so I could probably spend a couple hours talking to you about this. You're exactly right. Childcare is expensive, and I want to underline a point, right? When you do some math on the back of a napkin, people think, well, yeah, that lady down the street's got 10 kids in her house every day. If she's making $200 a week times 10 kids, that seems like a lot of money, right? But when we actually study the business side of childcare, the profit margins are incredibly slim. And so there isn't a lot of money being made in this field. And so that's why our nonprofit exists, is precisely because the business model is broken. But there is no doubt that it is expensive. And so when you talk to young families, they are paying the equivalent of state college tuition for childcare.
Yes, they are.
Those costs are the same.
They are.
In a time when they're young in their career, they may not be making as much money as they will be down the road when they're trying to get their kids in college. And so we have to think about viable solutions at multiple levels to make childcare affordable. So when we think about doing that, that's where your community has a role. And that's where public policy also comes in. One of the places where we have an office at First Children's Finance is Vermont, by large, a rural state. And we're watching some transformative policy work happening in Vermont that is changing the availability of childcare. So Vermont passed something called Act 76, and they're talking about how to create universal childcare. And before you think, oh, Vermont is crazy, wild, liberal state, it's not. It has a Republican governor, but it is a state that said, we have an aging workforce, an aging population. We need Vermont to have more young people. And if you need to be able to afford a house and live and work in our community, childcare is part of the equation. So they have a small payroll tax that funds universality. It's growing, but about right now in June of 2026, as we're recording, I think about 98% of Vermonters who have young children are eligible for child care subsidy. So that is everybody. I think they're at like 400% of federal poverty level. So I think that equates to, people who are high income earners actually being able to access child care subsidy. So that's a really interesting thing that's transforming Vermont. And it was, passed in the legislature. It has a lot of support, even with a Republican governor. And it is making childcare available to all. So that's really interesting. And you might think, hey, we're not Vermont, we can't do that. But I see the same kinds of things happening at different scales in communities across this country. We've seen really small communities say, we have one child care center in this small town, and it can't be sustainable. We talked about that earlier. We don't have 100 kids to enroll in it, but it's so important that we're going to pass a local levy to be able to, buy that building or take all of the operational costs off of the budget so that we can make it work. And so that's where rural communities are really thinking creatively about the facilities, the assets, the social capital, the financing, or the policy that they have available locally to think about, how can we do this, make sure that it's the right size for our community, that it's sustainable, and that we think about it as infrastructure. I happen to live in the upper Midwest, and so one of the things that a community member said to me is, hey, we have a pool, and that pool can only really operate in June, July, and August. But it doesn't make money. It never even comes close to breaking even. But we think about it as important to the quality of life for people who live in this community. And we don't think twice about subsidizing the library or the pool. And yet childcare, which makes sure that people can live and work in our community, we think, oh, that's a family issue. Someone should be paying for that. We're not going to do it. And that has way more impact than the pool or the library. And they started thinking about it as infrastructure. And that's what I would challenge rural communities to do, is to not get caught on the problem, but think about what are the creative solutions that can be built in your community that make a difference and make that childcare affordable.
Very creative, certainly. It sounds like it's nonpartisan in the state. Are you seeing or hearing anything at the federal level that's being done to address this gap?
Yeah. Well, for decades, the federal government has had a suggestion that no family should be paying more than 7% of their income on childcare. And we have blown past that many, many years ago. And so there's still that recommendation. And so what we find is that states are working at different levels to be able to think about how to get to that 7%. And they're leveraging their federal dollars at the state level to deploy federal and state match dollars for the Child Care Development Block Grant in innovative ways. And so that really is, a federal suggestion, not a requirement, but then I think the action comes down to the states. And so the advocacy is actually more local than you may think for that federal requirement.
Yeah. Well, that'll be interesting to see how that plays out. Obviously, we have a lot of federal issues going on right now, and certainly it doesn't seem like Washington's too involved in solving too many rural problems these days, but I guess we'll keep an eye on that. All right, let's talk about where the intersection occurs then between childcare and healthcare, because I believe there is a true intersection there. And so what would you say that you have seen in that area of overlap? Is there an overlap, number one? And tell us about your work with rural hospitals as it pertains to healthcare and childcare.
Yeah, I would think about childcare broadly as a social determinant of health. And so I think that connection, I'm going to talk about it in a couple of different ways, but let's start with that nurturing wonderful early learning experiences that positively impact young children create a social determinant of health. Yeah. It means that kids who have access, even as infants are learning every day, all day long. And you might think, oh, they're not in school. Right. Well, infants are learning, and their caregivers, their parents, the people that they're surrounded with, and the environment, including childcare, are framing that brain development, their cognitive development in so many ways. And so there's definitely a direct crossover between childcare and health. And then as we think about childcare at a community level, we know that childcare is an important factor for a healthy, vibrant community. And that regional economy is reliant on the supply of high quality childcare. When we think about just hospitals in general, healthcare also crosses over with childcare because it's an employer issue. In lots of rural communities, a hospital may be the primary employer, one of the largest in the region, and has a distinct workforce with needs that make a challenge for childcare. So when you think about 24-hour healthcare, who's working at night? Who has to be on the floor providing nursing care at 6 a.m.? Where are they getting childcare? Yeah. That is a huge challenge for hospitals. And so they are thinking about it from a health perspective, but they're also thinking about it for a workforce perspective. How are they attracting doctors and nurses to move to their rural community, and how are they going to get childcare when there is non-traditional hour work, shifts work happening? And when you are interacting with a female workforce, I think that even is more pronounced. Yeah. When we think about the amount of moms and dads who have young kids at home who are relying on childcare, nursing and associated healthcare careers are directly connected. They are directly connected, so it's absolutely in the best interest of hospitals and communities to think about innovative solutions.
Okay, so let's take it one step further for our final question of the day, and that is, what can hospital leaders, executives, do to help bridge this gap and work together to create opportunities instead of barriers for access to childcare? What if you had the availability, which you do right now, to tell healthcare leaders across the country, which is who's listening, what they should be doing in this arena? What advice would you give, and where do they start?
Yeah, great question. I'm so excited to give you a long list of suggestions. Please do. Well, first and foremost, I would say that hospital leaders should educate themselves about childcare and start to think about it less as a family issue and to think about it as an infrastructure issue in your community. Just like healthcare, you want to think about childcare in the same way. There's a spectrum of possibilities available to explore, and hospital leaders and hospitals in general, or hospital systems, have a unique role to play. So let's just get like a very small things, right? So every childcare entrepreneur in your community is required to be certified in some basic things: CPR, first aid, preventing shaken baby and SIDS. And so often in rural communities, those trainings are expensive and hard to find. So make it available, make it available at no cost, and you are immediately going to gain allies from the child care sector. All of those people need some of those basic things, and they are struggling to find them. The other thing is that hospital leaders want to think about their own workforce and their employees, and thinking about how they can provide options for childcare in partnership with existing community-based childcare programs, whether they're family, home-based, or a childcare center. They have unique needs, and they want to think about how they can be competitive in attracting and retaining their own workforce by partnering to be able to make sure that they have slots available for their employees. So that could be anything from a financial incentive, making sure that you're providing dependent care, flexible spending accounts as part of employee compensation. That's one end of the spectrum, to something at the complete other end of the spectrum saying, hey, this is close to our mission. This is mission aligned. Let's think about how we not only serve our own employees, but we provide community childcare slots in unique ways. We're going to put some dollars there, or we're going to leverage our facilities, or we're going to think uniquely about how we can partner to stabilize childcare in our community and add to the supply that we need. Another thing that you could think about is investing in local solutions that may have nothing to do with the health system or the hospital in your community, but when the tide rises, all of boats float. Right. And so thinking about investing in that care in your community is great. And then finally, healthcare leaders have a unique position to advocate. When child care folks go to the Capitol, they think, oh, isn't that nice? But they don't necessarily have the ear of decision makers, legislators, governors, agency staff in the same way that hospital leaders do. And if you go there as a hospital leader and say, we've got a child care problem and it's impacting healthcare and hospital sustainability in our community, that gets listened to.
Sure does. Advocacy, advocacy, advocacy. We often do it. I have spoken to our legislative body about access to housing, access to daycare, access to transportation. Seems to be three themes in rural America right now that we're all struggling with. And so be an advocate if you're listening today, senior executive or the executive at a hospital healthcare organization. Advocate. Be a voice, because I guarantee you that a significant portion of your population right now of employees are struggling with these type of issues, specifically as it revolves around daycare and opportunities to find a daycare to meet the needs of your shifts and schedules. It could be helpful for you to take a action on this particular subject and potentially partner to identify, maybe even give cash, financial support and payments that would help prop up a daycare of sorts. So we've looked at it here at Hillsdale. Obviously, there's so many competing interests. You need new technology and you need new infrastructure. You need to keep the community working and engaged, that it can be a heavy burden. But as we continue to look at that ourselves, we're asking ourselves a question, what is important to us? And having a workforce that is able to work is critical. And what we find as a barrier is access to childcare. So very good points today, Heidi, that you've given. Extreme pleasure to have you on this podcast to explain to our listeners about what they can do. First of all, analyzing the problem in our country, which is significant. Really sounds like whether you're urban or you're rural, The only impact for urban is you might have shorter distances to go, but there's still problems. And for rural, it is truly geography, lack of adequate coverage, and then cost. And so if you're listening today, hopefully you've been charged up by Heidi and the example she gives of state that did rise up and took this. Maybe you're listening today as a legislature. Give some thought into leading your state in that discussion about how can we help support that infrastructure and truly looking at it as infrastructure. So you've given me a lot to think about myself, Heidi. You've been a tremendous resource for us today. And before we conclude, we ask each of our guests to give a rural health leadership recommendation. So what would be a rural recommendation? And in today's very tumultuous environment of healthcare and the challenges from the one big beautiful bill to each respective state not picking up the Medicaid rates and the devastation that's impacting us with recruitment and retention and all of the challenges that it can be very daunting right now for a leader. So what advice, sage advice, what wisdom, what tip would you give to a young leader rising up today that's saying, you know what, these are some rough times, but what advice would you give them for whether it's your particular field or whether it's just in general leadership to continue keeping on?
Well, I think I thought about this a lot before our conversation, and the one thing that I want to focus on is the strength of rural communities, and this is going to get to a leadership thing in a moment here. But I come from a place when something bad happens and it's harvest time, everyone rallies, and there's no questions asked. People just come together and they get it done. And that is the strength of rural communities. And when you walk into a room in a rural community, you see an individual, but they're wearing about 5 invisible hats on their head. They might be a trustee at the local church. They might be on the board of the local bank. They are connected to other things across the community. There's all these connections, and we don't need a formal agreement. We don't need a contract or a memorandum of understanding to work together. But what we can do is think about what are the assets that are available to us. And we don't need an endless supply of cash, although that would be nice.
Helpful.
And
if you want to give, you can go to hillsdalehospital.com under the Give tab.
That's right. But the alternative in times like we are right now, where states and communities are shuffling the deck to cover the operating costs and some of the things that we know are critical or are sort of on the chopping block, is to think about how we can build them sustainably and creatively with innovative solutions in our community. So think about what is the right size of the solution. You don't need a $5 gazillion building. I've seen communities think about starting 5 new family child care businesses in their communities for $50,000, right, with incentive funds.
Wow.
And the result is 50 new slots.
Yeah, it's true.
Instead of trying to build
it's a huge
something.
Impact, though, 50 slots in a small community.
Yeah.
It's huge impact.
Exactly.
Even 5.
And exactly where you need them.
Yeah.
So don't get overwhelmed by the problems, because there are many and the stacks of them around all the time. But to focus on the leaders in your community, the assets, and to think about what do we have and what can we do with it. Think in innovative new ways, and don't get stuck by policy or what the rules are. We can rewrite that. We can get a variance around that. Let's figure out what we need. What's the size that would be sustainable? What's impactful? And let's go for it and build it here right now.
Build it. If you build it, they will definitely come, because we know that we know the need is there. Wonderful, wonderful information you presented today. It's been great to have you on the podcast. I look forward to having you back. Hopefully, we can talk about other states that are expanding, and maybe the federal government that takes an interest in providing some resources back to the local communities. I think that's critically important. So, Heidi, it's been great to talk to you today.
Thank you so much. I'm so glad for the invitation.
And thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcasts. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com, and make sure you've subscribed so you never miss an episode. Until next time, remember, Rural Health Strong.